As you can see, Checkers has a wound on the inside of his forearm. This wound is about a week old, and it's going to heal by second intention. There are no stitches in there. He's been managed with a bandage over this wound for the last week, and so today we've taken his bandage off and we're going to clean it up and do a bandage change.
When you're cleaning a wound like this or trying to evaluate how much you have to clean, you want to be careful that you don't use irritating medications here, or soaps in this case. And you want to do actually sort of a minimal type of cleaning. You see that Dr. Forney's doing very gentle cleaning here. She's not trying to scrub that. She's not trying to break or damage any of the healing tissue there. Sometimes you'll find if a wound, particularly that's been under bandage and is a little bit older, that you have minimal cleanup that you have to do. You just maybe take some saline gauze and just clean it very lightly. Don't have to do much at all with it. Big thing is that we don't like to use anything irritating.
And as you can see, I'm sort of in a compromised position down here. I'm all the way down here by Checker's front leg, and so what I'm hoping that my technician is going to do is keep a real close eye on how the horse is feeling about what I'm doing, and really be aware of where I am in relationship to this horse.
And sometimes as a technician, you're the one that's working on the wound. You want your assistant to be paying attention to keep you safe.
Absolutely. When it comes time to choose your antibiotic to put on your wound, you have a lot of choices, some of which are based on what the wound's like, how deep the wound is, how serious you perceive the wound is, and some of it is based on the vehicle that the antibiotic is in. I want to go through the use of these multiple use containers so that you get accustomed to how we use them. One of the most common ones is the pound container. And of course the pound container has more antibiotic ointment in it than you're ever going to use on one application. And one of the most important things to figure out about it is how to get your antibiotic out without really contaminating your container or just making it too nasty over the course of time. One of the obvious ways is to use a tongue depressor. And just take out how much you need, put it on a piece of gauze, and you're in business. Alternatively, you could put a sterile glove on, or actually you don't even need a sterile glove, you could just use an exam glove and take a hunk out. And again, you haven't contaminated your container's just fine. Like that. So I got lots of silver sulfadiazine out now. One of your other choices that you could use would be, your classic squeeze tube, something like triple antibiotic, like you get at the drugstore, like you'd use on yourself if you had a little scrape or something like that. Very commonly used in veterinary medicine. And again, probably you just put it on a piece of gauze before you use it on the wound, like that. Or again, you could use your exam glove if you wanted to. One of the other products that you'll see used, perhaps less and less so, I think, Dr. Hamill, it would be some of the aerosol spray preps that are a little bit astringent, a little bit drying. The thing you have to be most careful of when you're using them is that, again, the horses aren't necessarily accustomed to having aerosols used on their body, and so both the sensation, that cold sensation, and the sound can sometimes be off-putting. I'm going to spray it on myself.
Yeah, they sometimes will really react and say, I don't like that.
Yeah, that's when they jump right on your foot.
Mm-hmm.
One of the other choices that you need to make during fly season would be whether you're going to use an antibiotic that has some insecticide or some fly repellent in it. This is one of the common over-the-counter brands, SWAT, but there are lots of them out there. And again, you would just use it like any multiple-use container. You just take out what you need either with a tongue depressor or a piece of gauze. You do need to be careful when you're making these choices, particularly if you're working on wounds around the face, because horses will rub at their wounds or they'll rub their face up against something, and the possibility of getting antibiotics in the eye, you have to really be cognizant of that when you're making those kinds of choices.
Sure, so lots of different things go into our deciding what we're going to use, whether it's going to be under bandage or not under bandage. For instance, I never use a SWAT under a bandage.
Why would you? It's got insecticide in it.
Right. Yeah, so it's just things that you're going to be have to put all in the mix when you're deciding.
Sure. Now we're going to go ahead, now that we've cleaned up Checker's leg and made a decision about our antibiotic ointment, we're going to go ahead and wrap this leg. Because his wound is up above the level of his carpus, I'm going to need to do a stacked wrap. to start here at the bottom and then have a second bandage up here at the top. That keeps the bandage from falling down the leg as Checkers moves around over the course of his normal daily activities. So first thing I'm going to do is put this bandage on the bottom of his leg. And Laura, you can help me out by just keeping me in bandage materials as we go. As you can see from some of the other tapes, I'm starting from the inside to the outside, front to back, wrapping nice and low, steady pressure. Okay, Laura, I'd like to have a vet wrap for this lower portion.
You can see there's going to be quite a bit of bandage material used in wrapping this leg. Even though we've got a tiny wound, there's no way we can get around it.
So again, wrapping my vet wrap, going in the very same direction as my leg cotton, going down to the bottom, coming back up again. It's not important that I get all the way to the top of the wrap with this vet wrap because I will be adding more bandage material afterwards. In some ways, I'm just stabilizing the lower portion of this bandage before I apply the next portion of the bandage. Okay, now I'm ready for my antibiotic, and I'm going to go do the part directly over the wound. So I'd like apply my antibiotic, and then I'd like a nice Telfa pad. I think I have a Telfa pad up there.
She's chosen to use the silver sulfadiazine. It's a nice ointment, very non-irritating ointment, and I've been very happy with it over wounds.
And I'd like some cling, please. The white cling gauze. This is nice going over because it conforms a little bit better to the leg than some of the other gauzes. So he's going to get a nice little cling here. Now after I finished with my cling, then I'm going to use my leg cotton over top again. So I'll take my second of the big bulky roll cottons here. It's nothing like having a good patient, you know. You can make bandaging look pretty easy when you have a patient that stands here. You can make bandaging look pretty hard when you have a patient that dances around on top of you.
Oh, haven't we all been there?
Now once again, starting from the inside to the outside, going from the front to the back. As you can see, I have a little bit of overlap. Okay, Laura, I'd like a brown gauze, please. I'm going to stabilize this just a little bit better with my brown gauze before I go to my vet wrap. Everybody you work for is going to have a little bit of a different trick here and a different trick there. You know, this is sort of a standard bandaging technique that I'm showing you here, but you know, the person that you work for may choose to do it somewhat differently than I do.
And we all like to think that our way is the best.
That's right. And as Dr. Hamill said, this is a relatively large bandage in relationship to the size of the wound on this horse. And yet, in order to keep the bandage all the way up over the wound, I end up using what seems like a lot of bandage material. I'm ready for some vet wrap.
But if we didn't do this, our bandage would just slide down the leg with his walking, with his stamping, because the way the leg is shaped, it would be down around his ankle before we knew it.
Probably before we drove out the driveway. So you can see I've overlapped my two wraps. I'm coming back up again. Now, up here at the top, I'm going to use one of the great products of all time, Elasticon. Because Elasticon has adhesive on it, it's going to help me keep everything in place up here at the top. So,
and it's a stretchy bandage, but it has adhesive on it, so it really stays in place.
And so I cheat a little bit by coming all the way up and actually catching a little bit of Checkers' hair coat here at the very top. Because Checkers is such a sweetie, he'll tolerate this. You know, on a more thin-skinned horse, they don't object to you putting it on, but they do object when it's time to take it off. And I'll need some scissors for this.
That gives you a nice firm collar, so to speak, at the top of the bandage and helps it stay put.
Well, there you are. Isn't he beautiful?
It's a good-looking bandage.
as good looking a bandage as this is, lots of horses spend all their time taking their bandages back off again. So Dr. Hamill, why don't we demonstrate some of the mechanical things we have for preventing horses from doing that.
That's a good idea.
Let's start with the muzzle. Now, you see lots of muzzles around because people also use them as grazing muzzles for horses that tend to overeat. But muzzles can be used as a way of preventing a horse from taking his bandage off. Laura, if you can give me a hand over there on that side. So, basically it is. It's just a grazing muzzle. Goes on over the top, fits just like a halter. He can't really wrap his teeth around his bandage, and there you are. You're all set up. Okay. All right, we can take his muzzle off, and we'll show them. Perhaps we can show them a bib. Bib's a little different. The bib operates just on the underside. So basically it's just as you say, a bib, and it hooks onto their halter. They can eat, they can drink, they can do just about anything they want except reach down and grab either their bandage or their blanket. Sometimes you'll see horses that tear their blankets get to wear a bib. And then this one is really the most extreme, is maybe not the right term, but it is the most, wow. This is called a cradle. And you use a cradle on a horse, again, to keep them from reaching down and tearing off their bandage. So this cradle isn't a great fit on Checkers because it's set up for a bigger horse than Checkers, but it's the equine equivalent of an Elizabethan collar. So we would hook up this cradle on Checkers, and again, because his neck is fixed, he is not able to reach down and tear off his bandage or tear off his blanket or whatever it is he'd like to do. Here, Checkers, would you like to give him a nice side view like that? Just like that. So those encompass the three mechanical ways we have to keep them from tearing at their bandages, but very commonly horses can be deterred just by simple chemical means. This is a commercial product. You've probably all seen it. This one's called bitter apple. Spray it around the top of the bandage. Frequently in barns you'll see people use paste made with cayenne pepper. That's pretty exciting. And sometimes you'll see people use paste made with detergent, and that works also.
Anything you can get that they don't like the flavor of it deters a lot of the horses, and particularly Checkers. He's probably going to leave his bandage alone without anything.
Sure.